Hi, I am Bravo, and we are the UROFOLLITROPIN.
There are two drug classifications, the therapeutic and the pharmacologic. My therapeutic classification is that IM used for infertile women, or infertility means unable to get pregnant after a year of trying. My pharmacologic classification is ovulation stimulator and gonadotropin. And gonadotropin is used for the increase of production of sex hormones and stimulate production of sperm and ova.
We are categorized in FDA risk category X for pregnancy and is contraindicated after conception has taken place. Before administration in each fertility treatment phase, pregnancy should be prohibited because during pregnancy, UROFOLLITROPIN is needless and not recommended.
UROFOLLITROPIN mainly consists of follicle-stimulating hormone or FSH. FSH attaches to the follicle-stimulating hormone receptor, which is a G-coupled transmembrane receptor. FSH binding to its receptor tends to induce phosphorylation and activation of the ACT signaling pathway and P13K or the phosphatidylinositol 3 kinase, which are known to control many other cell metabolic and associated survival or maturation functions.
Pharmacokinetics. The administration of UROFOLLITROPIN is either subcutaneous or intramuscular. Subcutaneous and intramuscular UROFOLLITROPIN administration are not bioequivalent based on the steady-state ratio of the peak plasma concentration and the region under the plasma concentration time curve. Through intramuscular route, compared to several doses of UROFOLLITROPIN SC or subcutaneous, multiple doses of us UROFOLLITROPINs IM resulted in peak plasma concentration and plasma concentration time curve of 77.7% and 81.8% respectively. Peak blood concentrations after 150 IU or international unit daily injections for 7 days were 11.5 IU per liter, and approximately 10 hours after intramuscular administration, the full plasma concentration was reached. The half-life of removal is approximately 15 hours after 7 days of IM administration. Through subcutaneous route administration, peak blood concentrations after 150 IU daily injections for 7 days were 14.8 IU per liter. The maximum concentration of plasma was obtained approximately 10 hours after SC or subcutaneous administration. The half-life of removal is approximately 20 hours after 7 days of SC or subcutaneous administration.
I am used in the treatment of female infertility to induce multiple oocyte growth with the exception of without the activity of a luteinizing hormone.
Contraindications. Us UROFOLLITROPINs are contraindicated for use in any patient with a previous history of hypersensitivity towards us UROFOLLITROPINs, in patients with uncontrolled adrenal insufficiency, uncontrolled thyroid disorder, or intracranial lesions such as a sex hormone-dependent pituitary adenoma. In some other cause of infertility other than anovulation, us UROFOLLITROPINs are also contraindicated. Additionally, it is contraindicated for children use, for men with normal serum concentrations of gonadotropin, suggesting normal pituitary function, primary testicular failure, and infertility other than hypogonadotropic hypogonadism, patients with primary ovarian failure because of its inefficiency in these patients, and patients with dysfunctional uterine bleeding or vaginal bleeding of unknown origin.
And now, let's discuss my side and adverse effects. First, in the integumentary system, exfoliative dermatitis, acne vulgaris, rashes, and injection site reaction. Second system is the circulatory or the cardiovascular system. My adverse effects are anaphylactoid reactions, pericardial effusion, stroke, thromboembolism, thrombosis, hypovolemia, dehydration, hypoalbuminemia, hypertension, hypotension, and phlebitis. The third system is the skeletal system, and my side effect is that I caused pelvic pain. Fourth system is the nervous system. My side effects are depression, headache, nausea, emotional lability, and dizziness. Fifth system is the endocrine system. My side effects and adverse effects are hot flashes, fever, and weight gain. For the sixth system is the lymphatic system. My side and adverse effects are anasarca, angioedema, and new primary malignancy. And for the seventh system is the respiratory system. My side and adverse effects are acute respiratory distress syndrome or ARDS, laryngeal edema, pleural effusion, pulmonary edema, pulmonary embolism, dyspnea, and sinusitis. For the eighth system is the digestive system. My side and adverse effects are abdominal pain, diarrhea, constipation, and ascites. For the ninth system is the urinary system, and my side and adverse effect is oliguria. And for the last system is the reproductive system. My side and adverse effects are ectopic pregnancy, vaginal bleeding, ovarian enlargement, uterine contractions, ovarian hyperstimulation syndrome or OHSS, leukorrhea, and gynecomastia.
In the nursing responsibilities, before the administration of the drug, the nurse must interview the patient to gather data. The nurse will ask the patient if the patient has an allergy to us UROFOLLITROPINs or any other part of us, if ovaries no longer make eggs, if the patient have any of these health problems such as a tumor in the female organs, enlarged ovaries or ovarian cysts, or vaginal bleeding where the cause is not known. During the administration of the drug, the nurse must read all the instructions in the product package for preparation and use. If some of the information are confusing, the nurse must consult the medical experts. Before using the medication, washing the hands with soap and water are vital. Clean the injection site with rubbing alcohol prior to injecting every dose. Track the product visually for particles or discoloration prior to usage. And lastly, inject the drug under the skin or into a muscle, usually once a day or as ordered by the doctor of the patient. After the administration of the drug, the nurse must monitor the well-being of the patient to see how the body responds to it and also to know and be alarmed about any adverse effects or side effects. Also, the nurse must evaluate the patient's understanding of the drug, including its indication and adverse effects to watch for.